antibiotics do not touch viruses. They kill bacteria and not viruses. So antibiotics will do nothing for those infections. And parents are putting a lot of pressure on GPs, going in, wanting an antibiotic for little Jimmy's sore throat or whatever. I think, certainly GPs will be they'll be very careful in their prescribing habits now. We are trying to cut down on the way we've been openly dishing out antibiotics in the past 10, 20 years. We're going to have to restrict that, because what happens, for example, because they're being used so freely, many patients actually take the antibiotics for 2 or 3 days, feel better and stop taking them. They haven't completed the whole course. Now, what's happening in your body, these bacteria, they multiply rapidly. They double the population within 5 minutes. So the bacteria population multiplying, and because they're multiplying, some of them are changing, mutations occur, and some that are changing, because they've been bathed in antibiotics, may develop a resistance, and then they multiply, producing millions more of the bacteria that are resistant to the antibiotic. And if you stop taking the antibiotic too early, then all the bacteria are not killed off, and more multiplying, and then they can be spread to other people. In this situation, it's not an Armageddon position, but it's something that is concerning everybody, including the head of the Department of Health in the UK and people across the world. So don't expect antibiotics to be given, for minor complaints. Your GP will decide when they're right. Don't feel deprived if you don't get a prescription for an antibiotic. There'll be a medical reason for that. And if these superbugs multiply, and they will do, we've heard about MRSA. These bugs are becoming resistant to every antibiotic out there. And we haven't had a new class of antibiotics in the past 20 years. So not a lot has been done to develop new antibiotics for the future. So, accept, if you're not being given an antibiotic on prescription, that's your doctor's concerned decision, and go with his decision. Don't moan and groan about it. If you have a course of antibiotics, take them till the course is finished, even if you're feeling okay. And there are other concerns about antibiotics are being fed to poultry and to cattle. They have some sort of effect in producing bigger, more muscly animals, and I don't fully understand that, but we're getting antibiotics in our food chain. Antibiotics are being passed out of bodies into water supplies, into sewage. They could be seeping back into the land. So, antibiotics, although they've changed the face of medicine, we have to be very wary of their excessive use in the future.